Okay.
Dr. Enrique?
You can begin.
Hello, this is Dr. Gonzalez. Again, saying thank you to you for participating in the 28th year of the Latino Health Forum. This year, we're talking about discrimination and health. And because of the pandemic, we have to do this event through Zoom. And as you know, it's going to be every day at noon, including next Monday and Tuesday. Today, we have someone that I have a personal appreciation. This is to remind you that the mask, regardless what Washington is saying, the mask is the best thing you can do for you and the others. So don't pay any attention. I don't know what they're thinking, if they're thinking. Well, today we are very happy, and it's my honor to present Dr. Michael Valdovinos, that is a psychologist that works at the residency program. We're very lucky that he decided to come to our program here in Santa Rosa, the family medicine residency program, because he has many offers. His experience is such that many people wants him to work with them. Before I tell you more about Dr. Valdovinos, I want to remind you about John Lewis, a congressman that is really a champion, a warrior, and is the first African-American that is in Washington after they being honored by everybody there. So John Lewis, we lost a big fighter for the people of color and the people without resources in this country. Well, Dr. Valdovinos was born in Sonoma County, so it's great. He came back home after being studying at UC Davis and California School of Professional Psychology. And then I just learned that he is going to be in a fellowship at Stanford. So that's amazing. For all the young people that are listening, just think, all these schools are not far. California School of Professional Psychology is in LA, but Stanford is across the street, kind of, and UC Davis too. So we're surrounded by wonderful universities. That shouldn't be a problem for you eventually, but you have to go to college. Dr. Valdovinos has been dedicated to be better and learn more to help our patients and be a teacher at the residency. He's also working as an advisor with some Latino health organizations. He's involved in so many things that I can spend half an hour telling you. I don't know where he gets the time to do it, but this is the spirit of service to the community that he has. And don't forget, he has a radio program on Tuesdays at 4 at KBBF. That is the first bilingual public radio in the county. And the county, no, in the country. If you don't believe it, it is being broadcasting for almost 50 years, the first one. So it's a jewel that we have that station, but also we have people like Dr. Valdovinos taking the time for his program. Thank you to our sponsors that allow us to have this forum in Zoom, and it's free for everybody. We can have up to 500 people. So please tell your friends, your family, your colleagues to just be at lunchtime and listen. We are going to have wonderful speakers, but today's speaker is my favorite psychologist, and I really welcome you, Dr. Valdovinos. Thank you.
Well, thank you for the kind words, Dr. Gonzalez. And I want to say, first of all, thank you to the whole team, really, to not only be able to pull this off in the midst of a of this pandemic, but also I really want to say thank you for giving me the platform to be able to speak to something that I think is really near and dear to my heart, but also something that I'm incredibly motivated and passionate to talk about. And lastly, really, to be able to really push this conversation forward, because I think that, and you'll hear me say this throughout the presentation today, that I don't think we're talking enough about this. So thank you so much, everyone. Awesome team at the Latino Health Forum to be able to pull this off. It's been a real joy so far getting to know you all, and thank you for all the support that you all have given me. And so anyway, thank you. So today we're going to talk about something that I don't know, how familiar people are with this. Oftentimes when people hear these words, behavior modification, they start thinking about robots, they start thinking about psychology, their eyes start rolling in the back of their heads, or they start going, what is this? And I want to tell you that this topic of behavior modification is a topic that, as a psychologist, most of us are familiar with, but this is a topic that in the course of college, it takes generally a semester, a class to go through this. And well, I'm going to try to do my best to pull this off in the next 50 minutes. So I do want to just tell you that, because don't worry if some of these concepts seem a little dense and fuzzy. I'm going to try to give you lots of, or quite a few examples of what I'm talking about. I really tried to, work hard at explaining how behavior modification works and why it's so important in the context of COVID-19 and our community here in Sonoma County. The other thing I wanted to say really quickly was there's going to be slight gaps, and probably not much that you're going to notice, but we have translators in the background working to translate these presentations into Spanish. And so we want to give them a chance. I tend to speak really, really quickly, so I'm going to purposely try to slow myself down, but there might be little gaps in between slides. And so it might come off a little weird, but we're really trying to be mindful of the folks who are trying to gather all this information in real time. So thank you for your patience. Next slide. So I'm just going to close this down so I can actually see the entire slide. So this actually was just something I came across yesterday. And this is Andy Slavitt. He's the former acting administrator for Centers for Medicare and Medicaid under President Obama. The reason I put up this slide, and really to sort of ground us in this presentation, is to let you all know that it's my belief that we currently have a way to address COVID-19. And what I mean by that is, I'm not saying that we have a vaccine. I'm not saying that we have the only or the best treatment ready for COVID-19. What I'm saying is that we have a way to address COVID-19. And throughout this presentation, you're going to see how we can approach this through a number of different ways, some ways that you might have already heard, some ways that you're probably quite familiar with. But I do agree with Andy that we absolutely have a way to curb this virus at this time. And I hope that throughout this presentation, I'm going to give you not just the, this is what we need to be doing, because I think we hear a lot of that. I'm going to try and drill down on some examples of how. Ultimately, though, this is not a presentation about telling you what to do, or rather, here's the exact steps. It's to hopefully get you to think a little bit deeper about a process that happens when we ask somebody to put a mask on, to wash their hands, to socially isolate, right? Hopefully at the end of this presentation, you will come away with a little bit deeper understanding why it's so difficult and why that hasn't really happened across the board, obviously, just by virtue of the data and how many people are still getting sick. Next slide. So here's a brief overview and outline of what we're going to do today, what I'm going to talk about. And again, we're going to leave a little bit of time at the end for some questions and answers. So really what we're going to talk about is I'm going to start with a little bit of a story, and I call that, a story of crisis. Before that, I'm going to tell you a little bit about some expectations that we all have or that we're leaning towards. But I'm going to start by telling you a little story. And then I'm going to go into what I feel, or what I'm feeling sort of is a pulse across the country, really around the world, about what we're being asked to do in the context of COVID-19, in the context of psychology and behavior modification. And then I'm going to ground us a little bit in terms of what are we talking about when we're talking about behavior, right? What are we talking about when I say behavior modification? And you'll be surprised when I ask the question, what is behavior? People think, well, duh, I know what that is. But when you really stop to think about it, you might be surprised by what the answer might be, or what the scientific answer is. And then we're going to spend a little bit of time, really the bulk of the time I'm hoping we can spend on talking about reinforcement, because really that is the gold here, the meat and bones of this conversation around behavior modification. And I'm hoping that I explain it hopefully in a way where it's easily digestible for everybody, because it is, again, a fairly dense concept, but I'll give you some examples, try to make it interesting and fun. And hopefully, you can get a better grounding in terms of what these concepts mean and how they apply to what we're talking about today. And then I'm going to finish with telling you the second part of this story that I'm going to tell you really quickly here in the beginning. So story of crisis and a story of hope are the same story that I'm going to tell you. And hopefully that will help, again, ground us in all of this talk about behavior, about reinforcement, about what people are asking us to do. How do we curb COVID-19? Next slide. So this is a slide that I came up with because I was trying to think about, okay, what is it that we feel we're sort of all leaning on, right? What is the hope? And I couldn't think of a better slide when I came across the slide. And I have to give credit to the Wall Street Journal, because they had this slide in the background of one of their articles. And I thought the first thing that came up when I saw this, I thought, wow, this is the hope, right? We're praying and hoping and leaning on a vaccine, right? All we hear about is the vaccine, the vaccine. When is the vaccine going to come? How quickly is the vaccine going to be here? That's when everything is going to get better, when the vaccine gets here. And listen, I'm not arguing against that, right? I'm telling you that I also have oftentimes, maybe sometimes once or twice a day, think, wow, boy, life is going to be so much better when we get this vaccine in place, right? And it very well might be, but I wanted to also give you a little bit of the reality to set in motion, or hopefully help motivate some of you to think a little bit about some of the concepts we're going to talk about today as a alternative to just waiting for a vaccine, right? Because that can feel pretty hopeless and helpless. And so if we want to go to hit the next slide and the rest of so here is the reality. The reality is that we are probably going to need around 300 million doses of this vaccine when it comes out. And the reality is we may not get 300 million doses, right? The other reality is that we're going to probably need some sort of system to distribute what's going to probably be limited supplies. And so I urge you, not speaking as a medical doctor or someone who has access to these vaccines, this is the best data that I could extrapolate as of yesterday, to give me a fair sense or a fair idea that if at the earliest we got a vaccine around January, it doesn't mean that January 5th we are going to be getting the vaccine, right? It might take a little bit of time. And not to, put a dark hamper or kind of talk negatively. I want to be realistic in the sense that I think a lot of folks, especially a lot of my patients, which is another area where I'm gathering this information from, or my sense of this is that we keep thinking that when we hear a date like January or February with a vaccine, it gets us activated, right? And it's hopeful and it motivates us to, and which is all great. We want that motivation. We really want to retain that hope, but we want to be mindful of what this reality is going to be. And hopefully with that reality, we can start setting into motion some of the things that I'm going to be talking to you about today. Next slide. Okay, so here's my story. It starts like this. This is a slide that's showing you some data as of the day before yesterday from Monterey County. So I'm pulling out away from Sonoma County and showing you some data from Monterey County. You'll notice that this data is not significantly different, albeit just a little bit higher in terms of the COVID data from Sonoma County, all right? What you probably won't be surprised to see also is that the Latinx community, the Latino community, the indigenous community is getting nailed by COVID-19 in Monterey County, just as it is around the country, right? That's not a big surprise to anybody either. Why am I telling you a story about Monterey County? Well, Monterey County was in a significant dire situation. Still, I mean, I'm not going to say that it's significantly changed, although they've made some strides, which I will tell you about at the end of my presentation, where I call the story of hope. Monterey County had a precarious situation in that their situation was that, you know, Monterey County is a huge farm worker community, right? Just as Sonoma County is, Monterey County is huge. If you've ever driven through Monterey County, you'll see just endless and endless and endless acres of fruit. They have, you know, meat packing districts, they have fruit, they have, you know, strawberries. I mean, it just goes on and on and on. So lots of different factories, robust workforce to support that kind of infrastructure. Well, what they were noticing early on with COVID-19 was that, you know, they were at significant risk, obviously, just as we were, and it started to happen. And so these big factories were shutting down, which was having not only a huge impact on the financial stability of the county, but more importantly on the individuals, and i.e., you know, Latinos specifically. And so they sprung into action, and by way of some community organizers that came together and really started to sort of take matters into their own hands in terms of being able to address this really dire situation. And what you'll notice, which is a story of hope, is that this is happening in pockets across the country. It's certainly happening in Sonoma County. And I have to give so much credit to so many people, including Dr. Gonzalez and his amazing partner, Mary. So many people doing so much good work. But I wanted to take us out of Sonoma County because, listen, we are not alone. There's a tremendous amount of people suffering, but I'm gonna dial back in at the end of our presentation and show you what some sort of outside the box thinking is happening to address a situation just like the one you're seeing right now, and very similar here in Sonoma County. Next slide. Okay, so sorry, my mouth is getting a little dry here. Here's the dire, what I call the dire request. If we pull back from what we are being asked to do, which is wear a mask, wash our hands, socially isolate, and I would throw the third thing in there that we're often being asked to do is get tested if and when that calls for the appropriate, you know, when you're being asked to do that, when it's appropriate to do that. If we pull back from that and we start thinking about, okay, what is the global ask? The thing that I came up with, the thought that I came up with that feels sort of, the totality feels overwhelming. And I'm talking all the way from, you know, the highest political level on through down through the communities and, you know, boots on the ground, community level, individual level. We're being asked to aim for a higher global pro-social behavior, right? And you're thinking to yourself, well, what in the world is pro-social behavior? Well, really in a nutshell, it's the intent to benefit others, right? It's, as a society, what we're asking for is helping, sharing, donating, co-cooperating, and volunteering for the benefit of others, not just ourselves, right? When we think about wearing a mask, I still hear people say, well, I'm wearing a mask to protect myself from getting COVID, right? You often hear that, right? Very often, not too often do you hear, I'm wearing a mask to protect others from getting COVID, right? And so what in essence we're being asked to do over and over again is to sort of aim for pro-social behavior, right? To become more of a we versus an I, right? And in consequence of that, or as a consequence of that, what we're being asked to do is modify our behavior to reduce COVID, right? Obviously. However, what's happening? Well, what's happening, I believe, is that as a country, we're not doing a very good job with this pro-social behavior, right? For a number of different reasons. And that's not to put the blame on just the individual, but the individual is really where a lot of the control starts. And yes, there's a lot of factors outside of our control, but I think when we start thinking about the totality of our situation, our individual behavior is really the last and only thing that we really have a lot of control over. And even then, you're going to see that sometimes we don't even have control over that. So anyway, next slide. Okay, so what is behavior? Seems like a fairly simple question, but if you start to think about it before looking at any of this, you're going to think, well, is it just me doing stuff? You know, this is a behavior, right? You sitting and listening to me intently and thinking, right? Rationalizing, that's behavior, right? So it could be something like a simple action. It may be something that you can't see, right? If you're studying, if you're intently thinking through, if you're practicing mindfulness, that can be a form of behavior. So it can be seen, or like you see on the slide, unseen, right? Covert. And the interesting piece of this is that even covert behavior has to be informed by some sort of thinking process, right? It starts there. Now, sometimes that can be conscious or unconscious, which is a fancy way of saying sometimes we think about it, we realize it, sometimes we don't. It just happens, right? A good example of that is walking. Most of us don't think about when we're actually walking, our legs moving forward, unless you're intently focused on doing that, right? What generally tends to happen when we are practicing a behavior like walking, what happens is that your torso and your head is sort of waiting for your legs to take you to wherever you're going, right? And that's an exaggerated example of just how this happens. Unless you're conscious of this, unless you have pain, right? Unless you have an injury, or unless you're actively exercising and you're mindful of your body, then you might be more mindful of the behavior that's happening. Otherwise, this could happen on a conscious and unconscious level. And you're going to start to see how this has ramifications on our behavior when it comes to something like influencing other people, being influenced, following through on things like hand washing, mask wearing, socially distancing, so on and so forth. So anyway, that's a little primer in terms of what behavior is. Next slide. How does behavior start? Where does it start? Or how does it develop? Are we born with it? Does it just happen automatically? Well, what we know so far is that it primarily happens through learning, right? And experience. So, there is there's actually quite a bit of data to also support sort of this, two factors, hereditary factors, right? Like temperament and personality. Fortunately and unfortunately, you may be thinking, oh gosh, I don't want to inherit part of my personality and temperament from parents, family. Well, unfortunately, there's some data to support that. Actually, there's quite a bit of data to support that. The good part though is the majority of behavior starts or is influenced or developed, I would say, through learning, right? And that's a result of things that you go through in your life, and then motivation. And we're going to get into that in a second. We're going to get into sort of the meat and bones of this in terms of the motivation that keeps you doing a certain behavior as a consequence of what you've learned, or eliminates you doing a certain behavior as a consequence of what you've learned, right? Because that's what we do. You go through life, you experience something, you learn something, either you do it more or you don't do it at all. And that's mostly motivated by motivation, and that's motivated by reinforcement. But don't panic, we're going to get there. Next slide. Okay, so what have we got so far? We know that our behavior is largely learned and largely learned through motivation and experience. The reason that you see motivation used twice here and bolded is because motivation is really important. It's really, really important, right? And you're about to see why. So the stronger we're motivated to do something, the easier it's going to be to increase or reduce behavior, right? Seems pretty straightforward. If most of you were motivated to be on this presentation today, intrinsically motivated, which again is a fancy way of saying you really wanted to be here, then it doesn't seem like a huge hassle to be here, although I may be boring you to death, right? And then you'll start noticing other behavior patterns develop. But motivation is absolutely critical for us to continue to do something or not do something, right? So hopefully you got that concept. We're gonna keep going here and you're gonna see this word again. So let's talk a little bit about how, let me see, check my time here. All right. Let's talk a little bit about this idea of motivation, COVID-19 and our behavior. Let's look at some motivators for COVID-19 and behavior. Well, here are some pretty clear ones, and I'm sure some of you can probably think of many more. This is just a very short list. Some motivators that keep us thinking about our behavior with respect to COVID-19. Well, it's frightening, right? That's something that we think about. That motivates us to do something or not do something, or do certain behaviors and not do other behaviors, which again, we're going to discuss. The fact that COVID-19 can be unpredictable in the sense that you don't see it floating around in space, right? It doesn't hit you in the face and you go, oh, there it is, right? It hits some people, it sickens some people, and it doesn't make others as sick. We don't want to get it. I mean, well, actually, I shouldn't say that. I don't want to get it, right? And let me switch gears a little bit, right? We want to go back to hanging out with people, being around people. We are social creatures, right? It makes us sick to be isolated from others. Believe it or not, it makes many of us sick. Now, I could also go down the rabbit hole with you guys and say, well, depending on certain mental health diagnoses and or cultural customs, people often shift towards isolation. But globally and generally speaking, human beings are social creatures. We need to be around other people and have that sort of engagement, that touch, that influence, right? That connection, right? Reconnecting. So many of psychological interventions are wrapped around the concept of reconnecting, especially when you start thinking about things like depression and anxiety. So that's a very important piece of, motivators. And probably for many of you, certainly the people that I work with and myself, we're mindful of just how much of an influence being disconnected has on our behavior and ultimately on our mental health and our cognitive processes. The last two that I want to kind of just touch on is, obviously we all want it to go away, right? So depending on, how strong our motivation is for wanting to go away, we will become allies in this process of, doing things to help others and ourselves to reduce risk or not. And, I think it's important to mention that for many people, this really does feel like an existential threat, right? COVID-19 feels, for many of us who haven't been through a pandemic in our lives, it feels like, potentially, and I know this might sound like a sort of cognitive distortion or, exaggerated, but it really does feel like a global threat that could, I don't know, worst case scenario, wipe out half the world. And I've heard people say it's going to end the world. And so I want to make sure that I give a voice to really people, to folks who feel that the totality of this feels really, really overwhelming. It just doesn't feel like something frightening. It feels like a really existential threat that can wipe out half the planet if we don't address it appropriately. And so that's important to recognize, because you can imagine how someone who feels that way, how that might influence behavior and thinking. Next slide. Okay, good. So let's spend a little bit of time. This is where we're going to start talking about the concept of When you hear the word behavior modification, which again, let me strip that down really quickly to tell you, when you hear the word behavior modification, what I'm really saying is, how do you change behavior, right? How do you do that, right? And I'm not expecting, and certainly not suggesting or saying that in 20 minutes, you're gonna be able to walk out of the room and change everybody's behavior. If you do, fantastic. And if you do it for positive reasons, even more kudos to you. But this is just to raise an awareness around how we do this. And certainly in behavioral medicine and behavioral health and psychologists, it's a big backbone to our work, right? It's a fundamental part of our process. And believe it or not, you probably also do it all the time, and you're gonna see how. So learning plus conditioning is behavior modification, right? And you might be thinking to yourself, well, I have never heard of this word conditioning, right? Is it something I put in my hair? What's going on here? What is this word conditioning? Well, you're gonna see exactly what it's about. Essentially, it's a fancy way of saying either you're getting rewarded or punished for a behavior in an effort to either do more of it or do less of it, right? And when you start thinking through how to do that, that's when you start thinking about modifying behavior. Not to worry if that just kind of swept right over your head. We're gonna get right into it. Next slide. Okay, so let's tackle those three words: learning, reinforcement, conditioning, and then behavior modification. So we all do this all the time. Most of you who are paying, who are actively listening right now, what's happening right now is that we're going through a learning process. You're developing, you're hearing new language, you're hearing, things that you agree with, you may disagree with, you may be thinking new things around, oh yeah, okay, that makes sense. This is all what we call learning, right? And what happens is that unless you have a significant memory deficit, or if you have some sort of traumatic brain injury, or you have some organic brain dysfunction, oftentimes what ends up happening is the learning that you do, depending on how significant it is, it tends to stick, right? And it tends to influence behavior. Remember what I said though, to either continue to do something or decrease a behavior, right? Learning generally does that for us. Let me give you a quick example of how this works. If I've never experienced what freezing cold feels like, and I walk in one day to a cooler or an environment that's freezing cold, and I shiver, and I go, oh gosh, and it stops me in my tracks. I pull out of the room and I go, where's my jacket, right? How can I get warm, right? I grab a jacket, I walk back into the room. If I've never experienced what a cold room feels like, more than likely, I will forever now know that whenever I walk into a cold room, I'm gonna need something that's gonna keep me warm, right? And that happened by virtue of something that we call punishment, right? And not in the classical way of like, you're gonna get hit or it's gonna hurt, because that's not what we mean by punishment, which we're gonna address in a second, right? So behavior, that's an exaggerated example of how when you go through learning, those results tend to stick, right? If you're learning how to ride a bike and you fall off the bike, you tend to remember that, right? You tend to learn really quickly, how do you adapt from those experiences? Well, that learning process includes three concepts that we're going to spend the next 10 minutes talking about, 15 minutes, which is really the gold, or what I said before, the meat and bones of behavior modification. For those of you who have taken a psychology course before or have general concept of this, you might have heard of these things. I would say brush them up. They're probably covered in cobwebs at this point. But these concepts are not new concepts. They have been empirically validated and studied for a long time. I'll ask you to just kind of take my word for it at this point, or happy to, you guys research it on the back end. But there's three concepts that I think are also fundamental to the practice of psychology and psychotherapy, and really a lot of other career fields you're gonna notice. And those concepts are classical conditioning, operant conditioning, and observational learning, which is modeling. I'm gonna focus on the last two because they are, while all of them are relevant to COVID-19 and what's happening, especially in our Latinx community, but really globally, the last two are really very relevant. And I'm gonna start by giving you an example of one of these so that you can start to really see what I'm talking about, because that's the best way to grasp these concepts. When we started this presentation, Dr. Gonzalez had a mask on. And by the way, he's on the screen if he doesn't, if I'm lying about this. We didn't plan this. He had a mask on. He said something very important at the beginning. He said, I'm wearing this mask because it's still really important to wear a mask, which it is. What he did was he gave us an example of modeling, right? Which is observational learning. It's a critical component of changing behavior, modifying behavior. And I think he will agree with me, and hopefully some of you too, this isn't happening enough, especially by people that we admire and we look to for leadership. And so when you think about or hear this fancy word of observational learning, all it is modeling. If any of you have kids or you mentor younger adults or are mentored, you will often fall into this concept of modeling, right? You learn from people that you look up to or admire, right? Or teach you, right? So think about that. It's a very easy way of how this works. And it's also a very critical component of how you start seeing that in the absence of this, things like wearing a mask just kind of go unseen and unheard, right? Out of sight, out of mind. Next slide. Okay, busy slide. Here's what I want you all to gather from this. Positive and negative reinforcement. Positive reinforcement is simple. Something is added to the environment that makes your behavior more likely to continue or to reoccur. All right? Again, something is added to the environment that makes your behavior more likely to occur, to reoccur. All right? That's the positive, is that you're adding something to. Negative reinforcement is something is taken away, right? It's not negative in the sense that it's necessarily bad, right? Something is taken away that makes the behavior more likely to occur. So both times you're wanting to increase behavior or decrease behavior, right? And either you're adding something to the environment or taking it away. And we're gonna go through some examples of that. Next slide. Now let's get back to operant conditioning. So what is this word operant conditioning? And we're still talking about reinforcing here. We're gonna start talking about reinforcing here. So operant conditioning is, when you're deliberately reinforcing a behavior, right? And in hopes that it's going to continue. You can also hope that it takes away. But we're actually talking a little bit about increasing certain behaviors when we're talking about hand washing, when we're talking about wearing masks, when we're talking about social isolation. Not social isolation, restricting our social engagements, right? And so really what we're talking about here is that certain things need to happen in the environment, which sets the occasion for us to change our behavior. And then it's something that we end up doing. Then there's a consequence. And then, like I said before, it's that learning that then starts modifying our behavior in the long term, right? We develop a learning for it, right? And we're gonna get into some examples of that. Next slide. Okay. You might be thinking, whoa, what is this? Some instructions to build a battery? No, it's not. This is actually a very simple model for the concept of operant conditioning. And I bet that if I was in the room, you'd throw some at me for telling you this is a simple model. But I'm gonna show you it's a simple model. You've got 4 quadrants here, right? Just look at the R plus, the R minus, the P plus, and the P minus. This is what we use when we think about modifying behavior, right? So if you look at the R plus, we're talking about positive reinforcement. I just talked to you about that, right? This is the interventions that we use to modify behavior. And believe it or not, everybody here probably does this at some point or another, or is affected by this all the time, probably every single day. You might be thinking, no way, yes way. So again, positive reinforcement, remember, something that we're adding to the environment that makes the behavior more likely to occur, right? To reoccur. So it's a pleasant consequence is introduced to encourage a behavior. We're gonna go with that example. So how does that work? Let me give you an example of this, specific to COVID-19. I show up to work with a mask on, okay? And at some point, hopefully when I walk in and see my supervisor says, Mike, you know what? Good job for wearing that mask. I'm really proud of you. It shows me that you care about the where you work, about others, and certainly about yourself. You're doing a great job. I really appreciate you wearing a mask. What just happened there, right? I got, praise was given by a supervisor to wear a mask, right? Some organizations are actually tying this to performance objectives now, right? Think about that, right? Again, we're introducing something, right? We're adding something that wasn't there before, right? Which is reinforcing a positive behavior, right? Giving praise is a huge positive reinforcer, by the way. And we do it all the time, right? Dr. Gonzalez gave me some wonderful praise that I don't know that I deserve at the beginning of this presentation, right? Which made me feel awesome. It actually motivated me to be here even more and talk to you. Really, it did. And what just happened there? That was a consequence of positive reinforcement, right? So it's happening as we speak, right? And it's also happening in other ways where we're being forced to do this, which we're going to look at in a second. So again, that's positive reinforcement. Oops, sorry, go back. Let's go through these really quickly, as fast as possible. Negative reinforcement we went over already, right? That's taking something away, right? So that taking something away that makes the behavior more likely to occur, right? A great example of that is wearing a seatbelt, right? When you get in your car and you turn the ignition on, what happens, right? What's one of the first things you do besides put it in gear and go? You put your seatbelt on. And why do you put your seatbelt on? One of two reasons or both. The first reason is that you probably put your seatbelt on because in the event of an accident, you don't want to get hurt, and because it's the law. The other reason is as soon as you start driving, what happens? Bing, 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 right? You get that annoying sound. What happens when you shut the seatbelt on, right? You put the seatbelt on, the noise shuts off, right? So something was introduced, you shut something off, your behavior increases. Now, every single time you get in the car, in order to stop something, you put the seatbelt on, right? So at work, wearing masks, socially distancing, washing your hands, one way that that's negatively reinforced is you do that to avoid something bad happening, which is COVID-19, right? That's a really simple explanation of how how negative reinforcement affects our behavior. The reason that we wear masks, or some of us wear masks, is so that something bad doesn't happen, or we can stop something or avert something bad from happening, which is COVID-19, right? So we're trying to remove the consequence of COVID-19 by doing more of something, which is what we're asking people to do. Positive punishment is a little different. Again, it's not this idea of something bad or it's like something hurting. But what we're doing here is the reason that you see that it's decreasing behavior is that positive punishment is that, you know, we're adding something to the environment again, but this time we're doing it so that a behavior decreases, so that we stop doing certain something, right? So for instance, let me give you a really easy example of positive punishment, which again is we're adding something to the environment that makes the behavior less likely to occur or reoccur, right? An example of this is, you know, I'm sure you've seen in the news people walking into Costco without a mask. And what happens, right? They get kicked out. So what does Costco do? There's big signs in front of Costco that say, you cannot enter Costco without a mask on, right? So what ends up happening there is, you know, something has been added to the environment so that people will stop coming in with a mask, right? And so what ends up happening is that now you know, and social media has helped that, you know that you really can't go into Costco without a mask on, right? Worst case scenario is that you're gonna get put on Facebook or on Twitter and you're gonna go viral with you arguing with the staff and they're gonna kick you out, right? So what happened there is that we wanted to decrease a behavior. So what did Costco do? They added something like they instituted, you know, you must wear a mask. And what ended up happening was, well, you saw a bunch of people stop walking into Costco wear a mask. And they then increased another behavior, which was wearing a mask inside of Costco, okay? The last concept is negative punishment. Again, we're adding something, something is actually being taken away, right? something is being taken away so that a behavior either can, so that a behavior decreases, right? As opposed to those two quadrants at the top where you see that, we're adding something to the environment so that behavior increases. At the bottom, taking something away so behavior decreases, right? So negative punishment is, again, we're taking something away to the environment so that, we can, and I'm seeing that we've got not too much time left, so that we can make a behavior occur less, right? So one way that this has happened out in the community is, what you'll notice is, before COVID, a lot of farm workers would gather at their sites to mingle and hang out after the workday, right? They would have dedicated sites, or they would just farm at the actual wineries, and they would hang out. Sometimes they would drink alcohol, barbecue, and obviously that's a huge risk factor. So what some wineries started doing, and bosses started doing, is they started implementing, started not being able to do that, right? No more, these gatherings around the work settings, around, where people could cohabitate and then therefore spread virus. They were passing drinks around, sharing food. That was an example of negative punishment, right? Something that was taken away so that behavior stopped. Maybe they're going into other parts of the winery, but where I've seen and what I've heard, it's working pretty well. Next slide. Great. So in a nutshell, these are the three types of behavioral learning. The classical conditioning, we didn't talk a lot about it. It's important, but not, I would say we could go down a rabbit hole. We could spend 2 hours talking about this, but classical conditioning is a concept where you're using something you're using something neutral to motivate people, to behave a certain way, right? The classical example is, when you're giving a dog some food, you use a bell, right? Every time you give the dog food, you're conditioning that dog to a sound, right? Or what they call a neutral stimulus. You pull the food away at some point after you do that enough. Believe it or not, the dog is just going to react to the bell, right? They're going to start salivating. They're going to sit there, right? They're going to be excited. And all you're doing is ringing that bell because you made an association. We've talked about operant conditioning. We've talked about a little bit about observational learning, and I gave you some examples of how Dr. Gonzalez did that at the beginning. We're going to talk about it in just the last couple of slides that I have in terms of what this looks like in the real world. Next slide. All right. So you can pull up all, the whole thing here. Hit it again. Go through it and just hit the whole thing. So this is happening at work all the time. Your supervisors are doing it. This is really in your rating performance, right? You're getting positive and negative feedback, or as they would say, feedback to help you grow, or giving a warning, or being put on a process improvement plan, being temporarily suspended from work. All of those are examples of conditioning, right? All of those are examples of what we're talking about here, positive and negative reinforcement. Why? Well, it's either making you or pushing you to do more of something or do less of something, right? So you can see how this is really sort of really part of our life, right? It happens in advertising. It happens all through social media. It's a fundamental structure to our world. And I'm not saying that's always positive, because it isn't. People manipulate and unethically use positive and negative reinforcement, which is a conversation for another day. But just wanted to give you a sense that this is happening in real time all the time. Next slide. What people go through when they are their behavior is being modified. You may or may not know this, but a lot of us aren't attuned to this because it happens in real time. We're not thinking through like, well, what actually happens to me? Well, you actually go through a series of changes, right? The very first one is denial. A lot of people are still denying the reality of COVID-19. They're denying the use of masks, of hand washing. They're saying, I can get into a lot of the things that you probably already know in terms of folks are avoiding these realities, right? But then as people start making that shift towards accepting this reality, motivated to make change in their life, are motivated by what professionals are requesting of them, or educating them on how to modify behavior to reduce their risk and the risk of others, which is that pro-social behavior we talked about before, is that people actually go through stages of change, right? And that is really a whole presentation and conversation in of itself, which when you've ever heard stages of change, it really is the sort of the bedrock to how we address addiction, right? And how we look to intervene and help people with addiction. So we go through these stages of developing an awareness, a desire, which was that motivation we talked about. We start thinking through, well, how does this make sense? How is my thinking aligned with what I'm feeling and hearing? You know, we start making those behavioral shifts like, okay, today I'm gonna do it. I'm gonna wear a mask in public. I know I'm embarrassed about it, but I've got myself there. That starts to become a habit. And then we start really thinking about evaluating our process, right? Am I doing this enough? You know, I haven't gotten sick. All in the meantime, we're being reinforced by one reason we're being reinforced is we're not getting sick, right? You're not testing positive, you haven't gotten sick. Those are all really powerful reinforcers. Next slide. Okay, you know, this is pretty simple. Now I think you have a general concept of what the relationship is between COVID-19 and behavior, right? It's an incredibly important part of reducing the risk of COVID-19 for ourselves and others. Our behavior has, and I know I'm preaching to the choir here, has a huge role in reducing COVID-19. Our personality, which is our attitude and temperament, has an influence on the way that we behave, both positive and negative. And of course, our behavior directly impacts our health. Again, lots of examples of that outside this presentation. And then of course, I don't want to minimize that culture, social forces, politics, racism, all have huge impacts on our behavior too. We could have probably a whole conversation around politics and COVID and behavior, but really just want to highlight that all of those are really central and important to modifying behavior. Next slide. Okay, so I'm going to end with this. This is a story that I started with a story of hope. This is a very dense slide, but you know, just look at the top, if you will. I can kind of go through this really, really quickly. So what happened in Monterey County was really, really interesting. What's happening? And some of you are already familiar with this. Dr. Miguel Tirado was gracious enough to give me permission to present this and talk a little bit about this. There's lots of efforts. I don't want to imply that he's the only one doing this, but his work and the work that him and his team and his fabulous partner and all the people that are involved in the community, from the ag department to community leaders, to other physicians, to case managers and farm workers. It's a really amazing effort that's happening. So here's what ended up happening. Miguel Tirado was one of probably a number of other people in the county who started realizing like we need to give education, right? They started going out into the community to these farm workers, to farm working organizations and businesses, meat packing and fruit packing plants in the Salinas Valley to provide education, right? He enlists the help of medical residents and nurses to implement, education, and they just start going out and educating people. They surveyed lots of farm workers out in the Salinas Valley. And they realized that 25% of those folks had wanted nothing to do, only 25% agreed to do testing. So 75% of those folks at some point during these efforts came back and said, no way, we don't want nothing to do with testing. We're not gonna get tested for a lot of reasons, one of which is that they'd have to quarantine, which is a huge problem, okay? So it became real apparent to Dr. Tirado that really looking at motivation and taking ownership of the problem was central to making any kind of shift in farm workers' behavior, right? And so they trialed this model where they have mayordomos, which is the bosses, and community outreach workers agree to on-site training around job education and reinforcement. Next slide, and we're almost done here. So here's the interesting thing that happened, right? And he used concepts, and I've talked with him quite a bit about this. I don't know how conscious of during this process that he was actually building these interventions using positive and negative reinforcement, but that's largely a huge success to the program so far. So here's what ended up happening by virtue of largely operant conditioning what we talked about, which is the positive negative reinforcement, negative reinforcement, the positive punishment and the negative. So the farm workers started to become engaged, right? They took ownership to protect themselves and each other. This was Miguel Tirado's team, and these medical residents and nurses and case managers were out there providing education. And really at the very beginning, they were providing motivational interviewing, right? Basic concepts around working through ambivalence, developing awareness of these problems. So they started doing that, right? Building authentic relationships, transparency, and that's where they focused on for a little while. And what you'll notice is that when you take stages of change and motivational interviewing, it really starts to become the precursor to conditioning and changing behavior. And that's exactly what they did. So this interaction set in motion, a dialogue ensued. They continued to provide motivational interviewing, providing, working through the ambivalence, through the challenges. It was reinforced by mayordomos and growers. They were saying, good job. I'm glad that you went to the training, reinforcing Miguel's team and giving them thanks and praise in front of the employees. Guess what happened? And we're at, I think, the next one or two more slides. Next slide. The actual farm workers came up with their own solutions. They took ownership of the problem. They got excited. They got motivated, like what we talked about before. They came up with their own social distancing. Two things that they did was they limited, and they did a number of different things. I'm just giving you some highlights. They limited their carpooling, right? A lot of farm workers carpool to work because it's cheap, and it's a part of a cultural way to kind of connect and be together and laugh and listen to music on the way to work. So anyway, they limited that. They came up with that. So they limited it. So what was the previous behavior was heavy carpooling. The new behavior was limited carpooling, right? And I'm giving you some examples of exactly what the reinforcers were, how they were used, how were they reinforced. What ended up happening is that it increased their pro-social behavior. They realized, like, well, gee, I'm having fun driving in a car. I don't like, it's great that I don't have to spend this kind of money, but I'm putting other people at risk and myself, right? And so I have to limit that behavior, right? So what happened there is that they limited the behavior, right? We talked about that negative, that negative reinforcement. There was also positive reinforcement there, what we call secondary reinforcers, right? Which is praise. There was shaping that was taking place. There was modeling that was taking place, and they limited their carpooling. Next slide. The other thing that they did, another one of the things that I found was really, really interesting, is that before everyone would get to work at about the same time, and they would all clock in at the same time at the clock-in station, right? Whether it was a card swipe or clocking in, or a card, one of the old school, the cards that you clamp down and it marks your time. Everyone was congregating there, socializing, drinking, coffee and food and hanging out there and waiting for other people. Well, they realized, through the course of this education, they got motivated to change that. So what did they do? They came up with a concept of staggering and separating that clocking in. So you see the previous behavior, the new behavior, it was modified, really. The negative reinforcer there was the social distancing aspect, right? What did they introduce? They introduced, hand hygiene, right? They introduced limited social gathering. Those two things reinforced the concept of I am decreasing my risk, susceptibility to COVID-19 if I do more of this behavior, if I put alcohol on my hands before and after. That became the motivation to do it more. They developed a system of staggering their clocking in times. Fantastic. They did a number of other things, but these are some quick examples of how this happened through what has now developed into this concept of called La Charla Project in Monterey County, which is a fancy way of saying the Talking Project. Next slide. The good news is that that concept, we're looking at that concept to actually come to Sonoma County and use that here. There's people in the county that are doing some variation of that. So anyway, I want to end by telling you this. And this is a really, really important slide. I can't emphasize how important this slide is, okay? Please consider that you are a powerful force in this process. And I hope that when you look at what I'm saying here in this slide, at least one thing that you will think about is when you ignore, when you avoid, it has a powerful consequence on people's behavior, right? When you don't praise, right? When you don't reinforce a behavior that's positive, it has a powerful consequence on our behavior. If you think about what's happening politically, right? From the most top level leadership in our country, you'll see just the ramifications of ignoring this pandemic and ignoring something as simple as wearing a mask. If you want to extinguish a behavior, the fastest way you can do that is just ignore it, right? Seems easy and important, incredibly important concept. Please hold each other accountable, hold yourself accountable, wear a mask, wash your hand. We're not through this, socially isolate. I know it's annoying, but I'm telling you, part of the reason that we're here today is certainly one function of it is the slide that you're looking at here. Next slide. Okay, so here's what we talked about today. Again, I kind of give you the whiplash version of behavior modification. I tried to tell you a little story about how this is happening in real time in the community, give you a simple concept of what behavior is, a lot about reinforcement, and certainly, I apologize if you think if folks are saying, well, this is a really dense material. It really is. Hopefully, it drum up some motivation to think, wow, this happens all the time in life. Certainly, as again, in schools, teachers do this with kids. We do this with our pets. It's a really important concept, really, really critical to COVID-19, and really a conversation that we should be having more around, not just do this, but the question is, how do we do this? How do we do this as healthcare professionals to motivate and empower our patients to do more of this, our family and friends, ourselves? I hope that I was at least a bit successful in doing that and it was entertaining. I'm happy for the next couple of minutes to take questions. And thank you so much for putting up with me for the last hour.
Gracias, Dr. Valdovinos, for this really, really wholesome conversation right now about behavior modification. I think this is exactly what our community needed to hear. It's a different perspective and a different way to look at how we're tackling the COVID-19 pandemic. So thank you. We will now ease into the Q&A session. So I will be pulling up some of the questions that people were asking, but if you have a question to ask, please try to raise hand, use the raise hand feature, and we can try to call on you so you can ask a live question. If not, you can just type in your question in the Q&A section at the bottom. So we will start with a question from Daniel. So Daniel is saying, social isolation is a major factor in mental health, particularly elderly people who have been isolated for months, although really for everyone. And it doesn't seem sustainable over long-term, and over the long-term period, and video calls don't seem to cut it. Can we perhaps start to think of households as being extended to close family members who live at different addresses? And how do we mitigate to some extent this social isolation? Dr. Valdovinos, I don't know if you have an answer for that.
Sure, yeah, and I think, certainly a medical doctor can give more specific reasons why it's so important to continue to socially isolate, but certainly I can give you my opinion in terms of, I can totally empathize with that question, that, being around people that we love and care about, our family, our friends, and just in general, other people is incredibly, incredibly helpful to our mental health. So I completely agree with you, Daniel. And yeah, sustainably, I don't know how sustainable it is to continue to isolate in terms of if you're talking about just complete isolation, especially for our older folks. But I will still argue that it's absolutely necessary part of getting through this pandemic. I think that one thing that I've been certainly suggesting to folks is that if you have your mask on and you practice, appropriate social isolation, you can certainly be outside around other people. I think the rule is still 6 feet apart, but certainly if you stood 10 feet apart, you were outdoors, you weren't sharing things with people, but you were out there. there's still an energy and a camaraderie and a sort of a presence that's important for folks. And you can feel it when you're around other people outside. It starts to become a little sketchier when you do that indoors, when you invite people inside your home, when you're sharing dishes, sharing remote controls, or it just becomes a little bit more problematic, or you increase your risk. But certainly one thing that I've been suggesting to my patients is that, there's nothing that stops you from being able to go outside, keep distance, wear a mask, not share things. You're not, shaking hands. And certainly for our elderly folks, right? There's no reason why they can't take a walk outside with a mask on. Again, keeping separation, following CDC guidelines. That's incredibly important to our community, certainly to our health. And so I don't personally have the worldview that you should completely stay in your room and not go outside at all. I know there's a lot of patients that feel that, like, if they go outside and catch it in the wind. But I don't want to give the impression that that's absolutely what you must do. And I totally agree with you that it's very important for our mental health.
Yeah, no, definitely. I think that's really important for folks to kind of consider that while they're trying to take these precautions measures, definitely. So we'll move on to the next question. This is an anonymous question. This person is asking, what can the county do specifically to provide employers in high-risk industries, for example, farm workers, with positive/negative reinforcement in order to provide safer work environments to Latinx workers? Do you know of anything that's currently being done to protect them in these regards?
Yeah, I think part of what the county is doing, well, remember when we talk about positive and negative reinforcement, we're not just talking about something the county is doing, right? That's affecting us. And when I mean us, I don't mean to say just the Latinx community, really everybody. Is when the county is doing something or not doing enough of something or not doing something, it has consequences either way, especially with someone as powerful as the county who has leverage, who has influence. I think that something things that they could be doing, there's lots of things that they could be doing. And there's things that they are already doing. So one thing that they are doing is that they're bringing people together, different professionals together. They're bringing different organizations together. They're bringing community leaders together to really start, like, if you will, it's really a much larger version of the Chatela Project, right? To come up with solutions that are both grounded in a culturally responsive approach, a professional medical approach. I'd like to see a lot, more sort of a psychological lens on this, because I think the messaging is really important. But that's one example of what's happening, right? So I'm part of a group where we're working with the county and folks with the county to kind of bring a voice to this from the Latinx community. So that is an example of, of a reinforcer, right? And then the county is, everyone is giving each other praise. We're holding each other accountable. We're seeing people take action on these things. Those are all reinforced. And it's motivating people to do more of this type of work, right? So I think a big picture, that's one example of how, someone like the county can bring people together and reinforce these ideas. But there's certainly a lot of things that they could do on an individual level, right? They could highlight certain organizations or certain businesses that are doing a great job of this. They could specifically empower other organizations to do more work around these areas or support them in a more targeted way. But then we're talking about, these things take time. You're working with government organizations, but certainly the answer is yes, they can. There's some work already, quite a bit of work already being done. I don't want to certainly negate that. The county is obviously got their hands full. And so to answer your question, yeah, that's happening. And they're actually really quite supportive of some of the initiatives that we've brought to the table in terms of working with the Latinx community and the Indigenous community in Sonoma County.
Mm, definitely. And just to kind of add on to that at the end, for folks who are interested in a little bit more about COVID-19 impacts in different working like sectors and workers' rights and what's being done right now in terms of protection for essential workers. We will be having a discussion on Friday with folks from the Grain Day Labor Center and CRLA. So if you join in on that webinar on Friday, you'll be able to hear a little bit more about that perspective. So we have another question from Richard, who is thanking you for your educational talk, and also asking, could you perhaps also mention how governments use behavior modification to reinforce pro-social behavior? So I'm a little bit confused on this one, and what I'm getting is maybe what this person is referring to is this ease into kind of slowly, you know, opening things up and allowing for slow like socialization again. I'm not sure if that's exactly what they're asking, but if you want me to repeat the question, I can.
Well, I mean, specifically, how's the government using behavior modification to amplify or bring about pro-social behavior, right?
Mm-hmm.
And so if we remember back to what pro-social behavior means, it means that we're purposefully intending to benefit others, right? And so this idea that we're opening up the community so that we can all get back together again, so that we can benefit from one another through, mostly, I guess what I'm hearing from this question is by way of just being able to be around one another, which is something I argued earlier is really important. But I think what's important to consider here is at what cost, what's the risk, right? Because I'm not certainly saying that in every situation, you should positively reinforce something or positively punish something, right? Certainly we have to consider the context, the reasoning. You know, I'm not going to condition my dog to want to salivate to food every time he hears a gunshot go off, right? So we want to be mindful of the context here. And so, yes, I think the government, I would agree that the government is, certain aspects of the government, I would say certain people are motivated to open up the country. I haven't heard them say for pro-social behavior, but you know, I agree that they're trying to do that so that we can all get back to life is what I'm getting the sense. But I would be careful about the intention, right? I would ask more questions. I would be more critical of the decision to do that when our best science is telling us probably not the best time, right? And this is a good question in terms of just how these types of reinforcements can be used unethically or damaging in a damaging way, because that's a conversation we didn't talk about today really, but it's a conversation, it's a statement worth saying that certainly, you know, psychological methods are used both unethically and dangerously in the world, right? And I think without a lot of regard for the impact that they have on people. So yeah, I mean, it depends on which way you want to look at what the government is trying to do. But absolutely, they are trying, or at least they're voicing the desire to want to do that. Although I would want to know a little bit more in terms of, is it just purely economical? Is it really so that we can feel better? I'm not sure I can give you a good answer to that yet.
Mm-hmm. No, thank you anyways for that wonderful insight. We'll take one more question. Actually a question that I had earlier in your presentation. There was a step in kind of this idea of like of behavior modification, and for the person to kind of have that self like motivation or like that kind of care, initial like care to be able to like, continue with the other following steps. I'm not sure if I understood that correctly. I think it was on a few slides back, but so I guess how does that work? Does the idea of oh, I think it's forward one or forward two. Yeah, back. So it says yeah, the 5 distinct systematic stages a person goes through. Then the second one being desire to change. And I guess you know, how does that work? Because it kind of seems, I know you touched on it, you know, briefly, but it seems like it's easier said than done. And I'm pretty sure, you know, you feel the same way. And so I think that's kind of where, you know, as a non-professional and just kind of as a community member being observant, it seems to be that that's where folks might have that's where things become stagnant, right? That's where I sometimes I'm saying this as just an observer, but it seems like some folks might not have that desire to change. And how can we create that perspective or that feeling for folks in our community? Because essentially we don't want to, if we keep forcing people, it might be a little bit complicated. But if we're able to offer different kinds of tools to these folks, like how can we do that?
Yeah, fantastic question. And I wish we had an hour where I can answer. Or maybe you guys maybe don't wish you had an hour. But it's a fantastic question. You're absolutely right. If you force people to do something, what ends up happening is that you might get that individual to do something then and there, but it doesn't lead to continuous behavior, right? Actually, it leads to something that we call extinction, right? It's almost as powerful as ignoring behavior, right? So certainly forcing people to do something is not often the go-to approach. Now, what you're talking about here is a concept that I briefly mentioned when we talk about stages of change, right? And we use that word a lot when we think about people who we help who are recovering from or trying to work through addiction, like smoking or drinking. But I always teach, when I teach these concepts, I always teach it. I try to bring it outside of that context because it's just as relevant. It's as relevant for you and I, because what you're talking about is really, and the great question is, how do you get somebody from either like, I don't believe it exists, I don't really care, it's not going to affect me, right? To caring, to wanting to do something about it, and then the critical, whoops, something just printed from my computer, sorry. And then the critical piece is to getting them to do it, right? And that's a great question. And you're absolutely right that that it's hard and it takes time, right? So what I'll briefly mention is that sorry about that. I don't know what happened. My printer just decided to start going off. So what I'll briefly mention about that, and it's really interesting that you all can kind of look at on the back end. If you look at the stages of change, what you'll notice that there's 5 stages. There's pre-contemplation. Those are folks who are in denial, if you will, right? Or just aren't aware of it. They're not conscious to this, right? Most folks who you see who might say, COVID doesn't exist, I don't care, it's a hoax. A lot of those are avoidant in pre-contemplation for a lot of different reasons, right? And so they're not considering any change, they're not willing to do anything. What you need to do there in order to get those folks to make the shift to the next stage, what we call contemplation, is you raise awareness, right? It takes a lot of effort and a lot of patience, right? And so what you're talking about is that desire to change. The next stage, or the stage that we call, is contemplation to determination, right? They're contemplating it. They're thinking, well, maybe I need to do something about this. Maybe I need to change, right? But I don't know how to do it. I've heard of this concept of like wearing a mask, that I need to do it all the time. Don't really have the energy to do it. The 2 things that you need to work on, and I would suggest folks to look at this on the back end, is 1, helping people resolve ambivalence, right? This idea, helping people work through this like, but I don't know, no say, so really working through ambivalence, helping folks choose change, right? And raising awareness is really what's going to help people start making that shift from not wanting to do something about anything to starting to move behavior towards wanting to address whatever you're trying to address. Sorry, I think we're going to run out of time now.
No, well, thank you, Dr. Valdovinos, for that explanation. And I know folks had some questions left in the Q&A session. We will forward those to Dr. Valdovinos, and he will answer them on his own time, and we will post them on our website along with this recorded webinar. And we will offer a Spanish translation, which will be up in the next couple of days. So from here, I will hand it over to Dr. Enrique Gonzalez for some final words.
Thank you very much, Dr. Valdovinos. That's very kind of you. That was wonderful. We wish we had more time. I really appreciate it. And thank you very much for all the work you've been doing in the community. Really, I know that you've been working weekends, and thank you, and gracias, hermano, and we hope to see you soon.
Thank you.
Tomorrow we have Dr. Diane Kitamura, that is a superintendent in Santa Rosa City Schools, and she's going to talk about opening schools. It's going to be very interesting, and other questions that, other topics that are related to the COVID and the schools. So we hope we'll see you tomorrow at 1 and not 1, at noon, at 12 Pacific time. And as I want to thank Pam Rivas and Daisy Cardenas for their help. That has been amazing. We are going to have a Spanish version of all this. As soon as we have more details, we'll let you know. And I seriously recommend that you listen Dr. Valdovinos' program at 4 on Tuesdays, because it's always very interesting. And remember that this is important. I was by myself, so I remove it. If you have glasses and then they get kind of foggy, what I use is a piece of tape. And that works. After a while, you don't even know that you have a mask, and then you try to drink with the mask on. But it's important to use it. Thank you very much, and we'll see you tomorrow.